Alright team, we have a patient presenting with Gulfers vasculitis permeositis tenostatis pubis. Let's try to diagnose this.
It could be an autoimmune disorder affecting multiple systems.
I think it might be a rare genetic condition causing inflammation in the blood vessels and muscle weakness.
What about a bone infection leading to muscle pain and vasculitis?
It could also be a combination of all three symptoms pointing to a neurological issue affecting the brain and muscles.
No. You're all wrong. It's microhydranencephaly.
But that's such a rare condition, are you sure, Hawks?
I'm damn sure. Gary and Randall, get ready to perform rib removal on the patient. It's risky, but it's the only way to treat this.
Are you sure about this, Hawks? It's a dangerous procedure.
I don't know if we should take such a risk.
I don't give a damn about your doubts. Get it done. Leslie and Frank, break into the patient's residence. Look for any clues that could lead us to the root of this illness. Move! Tracy, you called me in here? What's the issue?
Hawks, you can't seriously be considering performing rib removal on a patient with suspected microhydranencephaly?
I don't need you questioning my years of experience, Tracy. I know what I'm doing.
You have a track record of being wrong, Hawks. Remember the last time you insisted on a risky procedure?
That's literally every day. Every surgery, no matter how complex, comes with risks.
But you pick extremely risky procedures for patients when you aren't even completely confident in the diagnosis.
Tracy, if you worked at McDonald's, you'd outlaw serving drinks with ice cubes because you think they're a choking hazard.
You're being generous if you think I'd land a job at a McDonald's where the ice machine functions at all.
Toucha, CLC.
Just perfect. The patient is in critical condition. We need to act fast.
Rib removal was not the correct treatment for microhydranencephaly, despite Dr. Hawks' insistence. We need to figure out the right approach.
What an idiot. Rib bones are not even in the head. Do you think it could be a misdiagnosis? What do you think Leslie and Frank found at the patient's home?
Probably clues pointing towards a different diagnosis, yet nothing helpful anyway.
Have you found anything yet?
Definitely not the cleanest environment for someone with such a rare condition like microhydranencephaly. It's crucial for patients to maintain a sterile environment.
I agree. Poor hygiene can have serious consequences for someone with compromised health. But what really puzzles me is this rib removal treatment the patient underwent.
I've been reviewing the patient's medical records and it just doesn't add up. The clues in this home suggest a different story. It seems like Dr. Hawks may have been misled in his diagnosis.
I don't think he was misled. He just comes up with a random illness and a random treatment like some sort of Mad Libs game.
Oh, so he's a leftist?
What does that have to do with anything?
You said Mad Libs.
That's not a political statement. That's referring to books with blank entries, where you can put any word you feel fits before knowing the context of the entire story.
That sounds like all sides.
Frank, again, this is not political. Hawks isn't even affiliated with any party. He's kind of on his own.
That makes sense. Where do you stand politically?
Why are you making this a topic? We have a patient that's dying and you seem insistent on wanting to discuss a rather touchy subject.
You're right. I'm sorry. What's your favorite church?
I'm not continuing this conversation.
You incompetent asshats. How dare you almost kill our patient with your misguided actions? Microhydranencephaly was a misdiagnosis and removing his ribs was the wrong treatment.
But Hawks, what we found at the patient's home, it wasn't related to microhydranencephaly.
Yeah, we were just trying to explore all possibilities.
Hawks, what do you think the real diagnosis is then?
That's what Leslie and Frank were supposed to find out. But for some reason they spent the afternoon in the apartment shooting the shit and trying to spark a political debate where it was least needed.
It was an honest misunderstanding. I'm just trying to get to know my colleagues better.
Frank, you've been playing devil's advocate all morning. First, you asked me if the Cleveland Browns got their name because they play like shit. Now you're asking people about political affiliations.
I'm not a Satanist, though.
And now you're bringing up religion again? Can you cool it with the hot topics, dude?
None of it even matters. I know all of us voted for Vermin Supreme and treat everyone equally. This is a safe space.
Unless you're one of Hawks's patients, since it's guaranteed their health will be put further in jeopardy before we help them.
I didn't think the discussion surrounding the Cincinnati Zoo could be topped in terms of stupidity, but we did it. You are so fucking invested in pointless questions when we have a dying patient who now has less ribs than McDonald's advertises in their sandwich.
Patients don't taste like sandwiches, Hawks.
I'm quite sickened by this lack of trying to do anything right around here. I'm gonna divide by 0 and hope this universe gets what's coming to it. So, how are things going in the oncology department, Johnson?
Oh, it's been quite a roller coaster. Some patients are responding well to treatment, while others are facing challenges. It's the nature of the field, you know.
I see. That must be rewarding and tough at the same time.
Exactly. But that's why we do what we do. How about you? Any interesting cases lately?
Actually, yes. I've been dealing with this one patient who's been exhibiting some mysterious symptoms. It's been quite perplexing.
Sounds intriguing. Have you made any progress in diagnosing the issue?
Not really. My incompetence four decided they were going to debate politics, sports, and religion despite us operating under the guise of a human resources department that would fire them for that.
Wow, that's a pretty dangerous game to play. I often have to move the discussion away from that when I have news for my own patients.
Anyway, I think I might have just figured it out, Johnson. It all makes sense now.
Really? That's fantastic news, Hawks. What's the diagnosis?
I'll have to run some tests to confirm, but I believe it's a rare genetic disorder that explains all the symptoms. I need to act fast.
That's really original.
I found it. The answer was right in front of us the whole time.
Hawks, what are you doing in here without proper gear? You can't just barge in like that.
This is highly unprofessional, Hawks. You're endangering both yourself and the patient.
Listen to me, everyone. Microhydranencephaly was a misdiagnosis. It's gigantism, I'm sure of it.
Gigantism? But what's the prognosis? How could you be so sure?
I had lunch with Dr. Johnson, and we went over the case. The prognosis for gigantism is not good, but there are treatments we can explore.
Well, we'll need more than just your word on this, Hawks. We need concrete evidence before we can change the diagnosis and treatment plan.
Oh, look, Frank cares about evidence again.
Are you idiots still trying to spark a stupid debate? Hello, there's a patient on the table with gigantism. What am I going to tell him when he wakes up and is surrounded by 4 jackasses who are really testing the limits of touchy subjects?
You've got a point, Hawks.
The only ones who keep bringing it up are Gary and Frank.
You guys are both snakes. I hear you praying frequently when you go to the janitor's closet together.
Gary, for the sake of everybody in this hospital, shut the fuck up. Frank, you two can preemptively shut the fuck up. Randall, Leslie, we have a human resources department. There's never been a better time to ask for Gary's termination with that kind of defamation. Thanks, Tracy. I appreciate the congratulations.
When did I congratulate you? I have a human resources director screaming at me over your entire department.
They're pretty idiotic, but the best way to handle them is gently.
No, they're telling me that this has been a major issue in your department for months, possibly years, and only now is everything coming out in the open.
Probably because we only got funding to have a human resources department a few months ago when Dr. Duke croaked. I warned you time and time again that I have some very risky employees, and you've spent all that time gaslighting people into thinking it's my fault.
You're being ridiculous. It's clear all 5 of you have dysfunction in your department.
Well, watch what you say. There's probably kids watching this.
Shut up. You know damn well what I meant.
I'm not really a fan of these vibes you're giving me. This hospital is meant to be a safe space, and you and my idiotic doctors are opening the doors for topics that easily alienate people. I quit. Enjoy figuring out what to do with my department now that I'm gone. Good goddamn riddance to all of you!